One of the big first topics we're going to be talking about is the fact that Governor Pritzker has signed a new law to protect medical privacy of healthcare records. So we're going to talk with State Representative Mary Beth Cansey. Mary Beth, are you there?
I sure am. How
All
are
right.
you?
So I checked in Mary Beth before you got on set about 11 minutes ago or so. And Mary Beth, what did I tell you? I said, listen, you're going to have to endure me and Mark BSing for about 5 or 6 minutes. Did I deliver on that promise?
You did.
See?
You delivered on the timing, on everything. Great.
Exactly. Well, we're glad to have you on the show. Thank you for taking the time to join us.
Happy to be
give us
here.
a little bit of backstory for people that are unaware of what's going on with this new law. Can you give us just a little bit of just some cliff notes as to what happened before we move forward?
Yeah, so I think you all know that back in 2022, the Supreme Court overturned Roe versus Wade. And coming out of that, we here in Illinois wanted to make sure that we were absolutely protecting people's rights. So we started that work. It continues on with House Bill 5295, which was signed by the governor earlier this week. And so as states criminalize abortion care and gender affirming care, here in Illinois, if you receive that type of care, it will be segregated within your electronic health record. And that way it won't be shown to anyone outside of the state of Illinois without the patient's express consent.
Now, could that create some problems when that person goes back to their home state and maybe has some medical complications? Now the doctor can't see their full medical records?
You know, this came up several times, and we didn't create this bill out of whole cloth. We talked to a number of providers, both within the state of Illinois and outside, who focus on reproductive and gender affirming care to make sure that we were protecting as much as we could without putting patient safety at risk. So an abortion will, if you have a complication, it will present as a miscarriage. And so patients would be able to say that when they walk in to an emergency room or to a follow-on doctor's appointment.
You know, I think it's fair to say, a lot of this, we hear it and we go, okay, sure, yeah, this makes sense. This makes sense to us. As we have learned with any new law that is signed in, there are always going to be people that don't agree with it. There are going to be people that push back. What have been some of the maybe the pushbacks that you have heard on this?
I think actually the one that Mark just raised is what came up most often. But again, this is why we focus so much on talking to actual providers of this care to make sure that we were doing what we could for as many people as we could without putting the patients at risk.
Obviously medical records are a thing that many of us want to keep private. It's our own private business and we want to keep it to ourselves. Yeah. Who are people, for maybe someone that doesn't know out there, that might need access to our medical record? What are some situations in life in which our medical records might need to be viewed by someone other than ourselves?
Oh, so these types of things happen, if you're going in to receive care at a doctor out of state, if you're an Illinoisan and you're on vacation, something might happen. You might need to step into an emergency room or a subsequent doctor. We know that a lot of people are traveling out of state and to the state of Illinois for their abortion care and their gender affirming care. And they might need subsequent care that is unrelated when they go home. Those records would all be open without this law. So now those patients can safely receive their care here in the state of Illinois and then go back home without fear of reprisal. As I was walking into the bill signing earlier this week, I heard from a provider. We were sharing the elevator, and she was telling me about a patient that had traveled to Illinois, received an abortion, and then went back to her home state where her home doctor saw that information and reported her to Child Protective Services in their home state. So this is a person who now runs the risk of, losing her children or having this traumatic experience and exposure to her home state CPS just because she got lawful health care here in the state of Illinois. And we don't think that's right. And we want to make sure that doesn't happen to people in the future.
Has that been a thing that's happened so far? Have people been prosecuted when they go back to their home states? Have they had repercussions up to this point?
Yeah, so the example I just gave is one, or we've also seen retaliation where doctors outside of the state no longer want to treat a patient because they don't agree with the decision to have an abortion or to receive gender affirming care. And so again, it's not always criminal, but there are other things that doctors could do, or others who would have access to this information. And we just want to make sure that folks are protected and safe and giving their consent if they choose to when it's necessary.
Yeah, I want to kind of go further. These are clips that a lot of times we'll pull these segments and post them online, so they end up
Sure.
being viewed by people not just here in Chicago, but really all over the country and all over the world. If someone from around the country is in a situation where they need to come to the state of Illinois, what advice would you have in regards to, they're worried about, the repercussions of this? What advice would you have for someone in regards to what the effects of this law are going to have on them, potentially in regards to going back home?
So what I would say is the technology companies, the providers of the electronic health records need time to actually set the system up. So the effective date is July 1st of 2027. So it'll take about a year for this to be fully implemented. But already we are having providers that are doing what they can to protect patients. And we have so many really good organizations that can help patients as they are figuring out how to get their care, here in the state of Illinois. So I would strongly encourage them to reach out to, Planned Parenthood or the Chicago Abortion Fund, several others, Personal PAC, et cetera, that can help in their decision to get the care that they think is right for them and their family.
And up until this point, HIPAA has not provided those protections. Is that what we're talking about?
Yeah, so this goes a step further than HIPAA, and just make sure that the data is not lost, it's not deleted or destroyed. It's just segregated and not shown without the patient's consent until they're ready.
Obviously, the governor has sort of signed this this new law into record. It stands to reason that he approves of it, he agrees with it. Have you had a chance to speak with him? Has he said anything about his thoughts on this?
I have actually. He has always been a strong supporter of a person's right to make their own medical decisions. I think that is a long part of his family's history. And we've seen it time and time again that he wants to help people to be able to make the decisions that are right for them without interference from the state or others, because he trusts people, he trusts women, and we're going to continue to do that across the state of Illinois.
Is this a law that will be made all the more powerful if other states look at it and say we should sign something similar into, is it, obviously it's a big deal if it's here in the state of Illinois, but if, 10 other states around the nation do similar things, does it kind of make it like a chain, a little bit more ironclad?
It does. It does do a lot of good in that way. And there are other states that have started to move in this direction. I think we're seeing some implementation of a similar law in Maryland and others. So I think it's just going to continue to get better and stronger as states go on. And hopefully one day we can get something done at the federal level. In a perfect world, we would all have the right to make all of our own medical decisions.
And you mentioned some of the other states that are kind of starting to do something similar. Have you heard directly from anyone in any other states, maybe even asking for advice? How did you guys go about doing this? What is the language with this? I mean, what have you heard from some of the other states?
We did. And so it wasn't just me, there was a wonderful team in the governor's office that was working on this for several months. And we had multiple conversations with providers and with lawmakers across the state, figuring out what did they do first, and what worked, what didn't work, what should we look out for. So we focused quite a bit on making sure that there was enough in the law to make it implementable and not have to rely so heavily on the rulemaking process, which can sometimes drag things out longer than we might want, and making sure that we were staying focused on what we call coded information when it comes to the technology, so that the providers of the electronic records are not having to make a decision, a subjective decision about was this abortion care or was it not? If it's coded in that way, it will be automatically segregated, and that takes them out of the decision-making process.
And Mary Beth, I know you mentioned it's probably going to be a year or so until everything is kind of ready to go
Just
on this.
about.
And so I hate to say, okay, well, what's next when we're still working on this thing? But I'd imagine in a lot of elements, there's still work to be done. What are the next steps that you're already looking forward to in the future?
Yeah, so I think we're really looking forward to working with the technology companies as they move forward, building these tools, perfecting the tools. We know they've already started working on them, and also reaching out to providers and making sure we're getting information out to the public so that they know how to use this power in the way that is right for them. So I think that we're going to see a lot of education going forward.
Interesting stuff. State Representative Mary Beth Cansey, thank you so much for really sort of breaking this down for us in a way that that we can understand. We really do appreciate you taking the time today.
Happy to do it. Thanks for having me.
Take
Yeah,
care. Have a
thank
wonderful
you.
day.